Which is better, cervical fusion or disc replacement?
It's a good question. I mean, at the end of the day, all these questions are they really come down to the patient, an individual patient, and there's pros and cons to each, and there's lots of patient factors, which I would discuss with you in person, go through in terms of age, demographics, what your goals are for the treatment, and what type of pathology you have, bone quality, etc. There's a lot of things to consider. But certainly in a younger patient, a great option, and even in some older patients, a great option is to preserve motion. The difference at the end of the day is with the fusion is just as it says. The goal is to weave two bones or three bones into one, and you lose the motion through that disc space. Whereas a replacement, or what we call an arthroplasty, is where you replace the disc material with, instead of a block, you replace it with a device that allows for motion. And just, I think in a lot of ways, visually, it makes sense to look at it. And basically, this is a model of the spine. And you can see here that these implants allow for motion, flexion, extension, and really side to side bending, which is mostly what you're going to see at this part of the spine. And essentially, there's two components. There's a top component here that has a spherical or partial sphere on it, and it mates with this lower portion down here that allows for that motion. There's all different types of implants, and they are made of all different types of material. Some are made of a plastic, like called a polyethylene, and some of them are made of metal or a combination thereof. But the goal of all of them is really to grow into the bone and allow for motion of the neck. And that's sort of counter to fusion, which in a fusion, the approach and the removing of the bone and the disc material is all very similar. But in this case, you put a spacer into that space, and then you put a plate and screws typically over top of it just to provide, just to keep from there being too much motion in this case so that it can heal itself and those bones can weave together. So those are kind of your two options. Ultimately, the arthroplasty is the goal is to preserve the normal mechanics of the neck.